Preventing an outbreak might always seem like the right thing to do, and that is often the case, though the right way to prevent, slow, or stop outbreaks can present a number of ethical challenges. Fundamentally, the ethical challenge in epidemic response arises from the question of whether it is more helpful to prevent someone from getting sick in the future than to treat someone who is sick now, or simply allocate those resources to addressing other social needs like housing, food, sanitation, and security. The trade-off between preventative care and addressing acute needs is always present, but it is often more apparent in humanitarian emergencies. Because of this, the World Health Organization has developed guidelines for the ethical considerations for vaccine programs in acute humanitarian emergencies that serve as a good summary of many of the issues that should be considered in responses to outbreaks in general. Experience has shown that populations are often at risk of infectious disease outbreaks during times of crisis, such as political instability, refugee crises, and natural disasters, because basic health infrastructure is often disrupted or absent, sanitation practices are difficult to maintain, and populations often become crowded. When deciding whether or not to initiate a vaccine-based intervention, one must consider the good that can be done, but also avoid doing any harm. We must begin by first asking, is there a demonstrated risk? For diseases that spread quickly, such as measles and cholera, using vaccination to prevent or slow epidemic spread may be justified to prevent illness and death. But any intervention carries risks, and one must evaluate the specific outbreak risk based on the nature of the illness and local epidemiological conditions, the probability of transmission, disease severity, and disease duration. An intervention, when not necessary, may take resources away from other public needs, but failure to help when possible and justified violates the principle of do no harm. A guiding principle in crisis response should be the fair allocation of basic resources. This is particularly an issue when vaccines are in short supply. With vaccination, this can be thought of in terms of equitable distribution of the vaccine itself, or distribution of the vaccine that results in the most equitable distribution of risk. Distributing vaccines most equitably, that is, ensuring that everyone has the same chance of vaccination, can conflict with the utilitarian goals of helping the neediest or preventing spread, since some individuals are more at risk of infection, more at risk of severe disease if they are infected, or more likely to transmit to others if infected. During the 2009 H1N1 influenza outbreak, there was a vigorous debate about allocation to those who were most likely to be at risk of infection, such as healthcare workers, those who were most likely to be severely affected by infection, such as infants and the elderly, and those who were most likely to transmit onwards, such as school children, for whom vaccination would have the greatest indirect benefit to others. Allocating scarce resources always presents challenges and often difficult decisions. Transparent decision-making for the communities affected by these decisions can improve engagement and compliance. This is easier said than done, but should always be a goal to strive for. Public health interventions must balance the good of the individual against the good of the community. This may present conflicts when interventions could limit individual autonomy for the benefit of the public good. The Syracuse principles, endorsed by the United Nations Economic and Social Council, state that public health may be invoked as a grounds for limiting certain rights in order to allow a state to take measures dealing with a serious threat to the health of the population or individual members of the population. These measures must be specifically aimed at preventing disease or injury or providing care for the sick and injured. These principles have been invoked to justify quarantine of infected individuals when the risk of transmission to others is high and the consequences of infection are severe, as was the case in outbreaks of SARS and Ebola. Outbreaks and humanitarian crises present opportunities to learn to facilitate current management or better respond to future threats. However, one must balance the benefit of such learning against the allocation of resources away from care and prevention activities. disease and program surveillance may be easily justified inasmuch as they allow evaluation of the current crisis and detection of cases that would require care, or may signal gaps in control efforts. When a measles outbreak started in Malawi in 2010, the initial response was to vaccinate children under 5 years, because older children are more likely to be immune. However, real-time analysis of case data by epidemiologists indicated that a large proportion of cases were in older children, and the vaccination response was extended to all children under 15 years of age. Thus, allocating resources to surveillance and analysis early on allowed a more effective outbreak response overall. Experimental treatments and therapeutics may be tempting to use during crises and outbreaks when conventional vaccines and medicines may be in short supply. This was highlighted during the 2014 Ebola outbreak. However, one must balance the potential to do good with experimental methods against the known ability of conventional strategies to work. In order to evaluate the benefit of a new vaccine or therapy, it must be evaluated against an individual who does not receive it, or who receives a placebo. Clearly, during an outbreak or in times of high outbreak risk, it may not be feasible or ethical to withhold treatment from some individuals to facilitate learning, even if it accelerates treatment of others in the future. This was the case in the vaccine trials during the 2014 Ebola outbreak. In the end, 2 strategies were employed in trial designs to overcome the ethical dilemma. In one, a so-called stepped wedge design, rates of infection in those who have received the vaccine are compared against those who will receive the vaccine but haven't yet for logistical reasons. An alternative strategy, that of giving an active control, where a proven vaccine that provided protection against another disease was given to those who didn't receive the experimental Ebola vaccine. This strategy had the best chance of getting fast results that could benefit the community, but knowingly left some individuals in the study unprotected. Though these issues had been posed in the context of crises, the ethical issues remain present outside that setting as well, and one must still consider ways to distribute prevention and treatment that maximize benefits and minimize costs to the individual and society, and that are equitable and transparent as well. In the end, there is no simple answer to the question of what is the best way, but consideration of these ethical principles in the design and evaluation of public health interventions is likely to at least steer us towards a better way.